Welcome to Democratic Television, a program of the Santa Clara County Democratic Party that brings interesting guests, perspectives, and attitudes that we're always happy to hear. Today our guest is Leslie Crowell, who is a county executive, deputy, who's been with the county for a long time and does a lot of interesting things. Leslie, we're going to want to get to hear some of these interesting things, but first of all, thank you for being on Democratic Television.
Well, thank you, Steve. I'm looking forward to this.
Let's see what happens.
All right.
Before we talk about your career in the county and all the different things that you do, where are you from? Where'd you grow up?
I grew up in Hayward.
Hayward.
And I had a very classic sort of middle-class 1960s upbringing, kind of Beaver Cleaver, if you know that era.
You know that era.
My dad taught poli-sci, political science, at Cal State Hayward.
Oh.
My mom was a stay-at-home mom. Mm. And then he passed away when he was 49. And so my mother went to work. Oh. And she's really my role model. I went to Cal Berkeley because I didn't really want to leave home at that point. I have one sister, but I was really close to my mother, and Berkeley and Hayward are, of course, pretty close together.
Oh, yeah.
I loved Cal. Party, study, football, politics. I mean, it just has everything.
Perfect.
Somebody could want. And then I had friends who had gotten a job with a local political official, and they asked if I wanted to come work with him, but that didn't last very long. And then I ended up working for Assemblyman Byron Scher in 1981. Love the
guy.
Oh, what a great guy. He's a role model. Very authentic person, really a principled individual. Of course, he's famous for a lot of the local environmental regulations, underground tanks, bottle bill, recycling, a lot to admire there. And of course, he owns corgi dogs. He got to go to Elizabeth's dinner at Golden Gate Park in 1982 when they shared corgi stories. But then I decided to go back to graduate school. I chose the University of Chicago to have a contrast between my Hayward and Chicago experience.
And UC Berkeley experience, too.
Yes, conservative, I suppose.
Yeah, exactly.
Although when I was there, Jesse Jackson was running for president. Oh. Harold Washington was the mayor.
Oh, yeah.
And Barack Obama would have been a community organizer at that time.
That's great.
And the U of C is on the south side where Barack Obama would have been. So it was really an interesting time.
I take it you didn't cross paths.
We did not.
Or maybe you're just being modest. That's okay.
Jesse Jackson had a Saturday morning program that you could listen to, and he would get everybody going, and it was exciting. It was an exciting time to be there. The Bears even won the Super Bowl while I was there.
Oh, wow.
So it was a great time. I've often said that if the weather were good in Chicago, everybody would want to live there.
Perhaps. However.
And so then my mother said, you should come home and take a civil service exam and get a job with the County of Santa Clara. And I said, you think I should come home for a weekend and take a civil service exam? And she said, management analyst, that's the way to get into county government.
Oh.
And I did. And I started with the county after I graduated from the University of Chicago.
So your first real job?
My first post-Byron Scher job, yes.
Sorry, Byron. Yeah. That, I would think, would be so much fun. You wouldn't think of it as work, but...
True enough, actually.
Yeah, I know Byron had great local staff and great staff in the Capitol as an assembly member and a senator.
We all just had a reunion with him in Sacramento in December.
Oh, good for him.
It was exciting.
Good for you.
Yeah.
So what did you end up doing in the county, at least in the early years?
So I had several different offers because that's how the county system works. Management analyst was a generic classification in civil service. And my mother's boss from Alameda County said, it's hard to get into the county executive's office. If you got a job offer there, you can always leave if you don't like it. And I've been there ever since, 1986.
Wow.
Until now, still. Management analyst in the budget office. And I started doing small budgets for several small departments, and I became an expert at a lot of little procedures and the way you understand the budget because some of the small departments don't have that many staff. So they relied on their budget analysts. I became an expert. And then I got the health department. That was fascinating. And it's a complicated area. And so then I developed expertise there. And Gary Graves, who is the county chief operating officer, was my boss at the time. And he's been my boss the whole 30 years. And
Gee whiz.
Yeah.
Now, it's to an outsider talking about putting together a budget for a department which fits into the overall county budget sounds a little bit dry. But I would think that behind the budget is what the county does, how it provides services, how it really says these are the things that we value, that we want to emphasize.
Well, it is. It's really the closest thing the county has to a strategic plan, because it is their decision of what to do with the money that the county gets from property tax or state or federal funding. Those are our primary sources of funding in the county. And so during the time I was working in the budget office, we had a lot of downturns. We had a downturn during the 90s, during the Clinton era. We had then the dot-com boom. Then we had the dot-com bust. Then we had the Great Recession. And so actually you're having to decide what not to fund, which is really challenging. And so you have to be very sensitive to go out and talk to all the different county service departments and say, how are you going to continue to provide the best service you can, even though we are in a recession and don't have the revenue to support you? And what our elected officials want to do is provide as much direct service as possible, which just makes common sense because you have clients that are depending on the county, and during the recession, they really do depend on government.
At a time when the county is leanest, how do you budget for that kind of thing, though? How do you deal with ebb and flow with a steady workforce that is expecting that they're going to be there after the next budget cycle?
Well, we have cut a lot of administrative services, which we're still sort of feeling the pain from that. And we're trying to build those back now that the economy is better. And the other thing is we need to negotiate with our bargaining units, our labor unions, and help them to understand the big picture, what it costs to provide benefits, what it costs to provide salaries, what it costs to provide services. And if you look at a tenure trend, for instance, you'll see that if you funded the same number of positions over the years, the cost goes up.
Yeah.
Because we do give people a cost of living adjustment and things like that.
Well, and healthcare costs go up, and the cost of doing business, everybody knows that.
So we've all partnered together during the lean years to make reductions, contribute more funds to our pension programs, things like that. And everybody really has to pitch in together to make it work.
It does sound complicated, though, because funding from the state and state-mandated programs could be two different things. The state says, you, the county, must do things, and here's not the money to do that. So
this is the $64,000 question. What level of service do you provide under the mandate? Do you provide the minimum level of service? Do you provide more? And interestingly, if you look around the state of California, depending on the political persuasion of the various elected officials, some counties spend more money on law and justice, for instance. Other counties spend more on health care and human services, and Santa Clara County actually happens to be one of those counties where we are seen as a leader in health and human service provision. And not all counties have that situation.
What makes us that? How is that priority prioritized? How does that mandate become known to the county administration?
Our local officials tend to historically have preferences that they let the county executive know about. And so when I started here, of course, we had different elected officials than we have now. In fact, when I started with the county, we didn't have term limits. And different elected board of supervisors holders had certain priorities. And we've had that historically because the community buys into that structure, because we have a lot of community-based organizations that provide services for us. And so over the years, it becomes really the fabric of who we are in the county, and we have partnership with those community-based services. So together, clients are used to being able to receive mental health services. One of the areas, for instance, we've done more in the area of homelessness services.
An explosion of numbers, and what do you do about it, and a lot of anguish and challenges in neighborhoods and everywhere else.
Well, and the county is interested in floating a bond measure to fund more affordable housing, and yet our discussions internally are everybody thinks that's a good idea unless that housing is next to them. And so will we be able to use that bond money within the time frame that bonding usually allows? And there are restrictions on that, and so this will be one of the interesting public policy challenges coming up right soon.
I think the top concerns of residents seem to be affordable housing, transportation, you know, economic support, the schools and things like that, but the county's issues are sort of at the forefront of all these concerns that the public has.
People really might not know the county existed unless they needed the county services. If you need to go to the hospital, Valley Medical Center is a trauma care site and also provides excellent rehabilitation services, for instance. They're known for that. We do have a large social services system because counties are agents of the state. So if you need any kind of welfare from the state, you'll get it through the county. And in terms of paying your property tax, we have that happening for anybody who owns property. And then we have the law and justice system, where anybody that's going through the courts, the jail, the public defender, the probation department, pretrial services, etc., that too. But if you've never had to encounter the legal system, you might not really think about the county very much.
So to many county residents, it's an invisible level of government, but you know, if it weren't there, people probably would say, wait a minute.
We do have a parks measure on the ballot.
Yeah.
The county has a large network of parks, and cities have parks, and the county has more open space parks to preserve it because we're in the unincorporated area. So that's probably the best way that your average person might encounter the county is through county park.
Got it. We're going to take a break right now. When we come back, we'll talk more about the county and some of the innovative things that you're responsible for to help manage 18,000 county employees. We'll be right back.
Hi, I'm Sally Lieber, former state assemblywoman, and I want to urge you and invite you to get involved in the local Democratic Party. Whether you're a student or someone who just has a few hours to donate, or you're post-career and you want to make a more substantial contribution, we really need you to do a lot of different things. Volunteering work, volunteering on issues, causes in the community, just being involved in the Democratic Party and making a difference while you can. Please contact us at the Santa Clara County Democratic Party. We need you. We want you to get involved, and we want you to make a meaningful difference. Thank you so much.
Welcome back to Democratic Television. We're talking about the County of Santa Clara, and we have Deputy County Executive Leslie Crowell with us talking about all the things that county does. There are almost 18,000 employees at the public's beck and call, ready to provide services. How does the county provide services? I know that's a big question and it depends, but you're a deputy county executive, so I know you can answer it.
Well, it's really all about the people. It's really the frontline staff. You know, the average county customer never would see somebody like me They might say, what is the county doing with a deputy county executive, or more than one of them, or anybody who's not really on the front lines? One of the services, for instance, that the county provides is 911 communication services. The person the most important to you when you call is the person who answers the phone.
Yeah.
Or the nurse at the bedside.
Yeah.
Or the road worker on the expressways. The county maintains all the expressways in the county. And it's that frontline service provision that we really think is important. And yet to provide sort of the vision of where any department is going, managers supervise people and give them direction, as well as help the department head, for instance, understand what's going on in the department, where we might have a problem, what kind of things we need to look to improve. And in fact, our executive now, Jeff Smith, brought this idea of continuous improvement into the county when he came in 2009.
Tell me what that means, continuous improvement, because I think we all assume we're supposed to continuously improve, and I know it means more than that.
Well, Jeff comes from a healthcare background because he has a medical degree. He also ran the health organization in Contra Costa County. And in healthcare, they have an effort that is patterned after the Toyota way, if you've ever heard about Six Sigma or Lean. It's a way to do efficient manufacturing, and you bring it into healthcare to increase patient safety. For instance, you don't want the nurse to administer the wrong drug, or you don't want the surgeon to operate on the wrong limb, something like this. So you have a lot of processes in place where it's clear to everybody what the right thing to do is, and it makes healthcare also more efficient because, as you know, one of the debates in our country and everywhere is the cost of healthcare and providing it to everybody. So you want healthcare to be provided in an efficient manner, but you also want it to be provided in a safe manner. And so Jeff brought those ideas to the county when he started, and at first he wanted to institute something that I thought might be like accounting for all of your busy work. And so I said to him, Jeff, could we have some hot teams, some teams of employees that work together to solve problems that they know exist because they're on those front lines? And he liked the idea. And so we contracted with a Stanford professor, Dr. Benham Tabrizi, to start the Center for Leadership and Transformation program, which is a leadership program for both county executive leaders at Stanford in the summer for 4 days, as well as for county employees in classes during the year to work on team-based improvement projects.
So it's leadership and transformation. Those are very aspirational terms.
You know, if you've ever been reflective about yourself, you really know that transformation starts within. Because how can you really ask somebody else to change if you're not willing to change? And that's what Dr. Tabrizi brings to the table. He's that way himself. He's an Iranian refugee who came here during the Iranian Revolution and as a teenage boy. And his family actually depended on county services when they were here as refugees. And then he's been at Stanford for over 25 years. And he's got a very compassionate heart. And he brings the intellectual side of process improvement with the heartfelt side of really caring about the clients, the customers, and about making the work as good as it can be on behalf of the clients.
So with all due respect to county workers, the image is of someone who's got a job, they do the job, and are less interested in the impact than just, you know, getting through the day, which seems to clash with exactly what you just said.
Of course, I think once you've been at the county a long, long time, if you have been doing your job in a little bit of an automatic pilot sense, maybe because you were very busy or the recession took your colleagues away, reduced the number of people you're working with, so you felt the burden of your workload, that's been painful. And that's been a painful period for county employees. And that's another reason why it's important to think, no matter what the circumstances, of you personally or the job you have, things can always be improved, and that it makes you feel better to be improving the same way that anyone feels better when they've had a good night's sleep, they've planted a new plant in their garden, they've buffed up their car, except this is about work. And it creates a real sense of camaraderie and collaboration. And it's the thing that makes a difference the most between feeling a little bit tired of your work and maybe that image people have of civil servants is that they're sort of just going to work and punching the clock, is collaboration. The sense you're working together for the benefit of what you're trying to accomplish and that you're making a difference.
So that's what leadership and transformation has evolved to be, at least in the county of Santa Clara, where people are opening up, getting to know their colleagues, and giving it their all.
You're right. And we have a program called California Children's Services. It's a state-funded program that provides services to children with a disability, a diagnosable disability, and they need to provide metrics to the state of California to show that they're getting eligible children into their program within a mandated period of time. And they've reorganized their entire department to make sure that they get all their data to the state in a timely fashion. And that project went so well that they've gone on to do other continuous improvement projects. And people who visit their office say that you can feel the difference the minute you walk in the door, that people are just humming. And they're happy, and the work is getting done, the clients are getting good service. It sounds a little bit Pollyanna. Of course, I think if I were to hear that story and I were in another department that doesn't have that feeling, I'd say I want some of that.
Yeah, yeah. A reason to go to work every day. Now, this sounds good, but you did mention the word metrics. Is there a way to know that this is successful besides people maybe feeling better? The impact on the clients, on the public?
Oh, yes. It's very important to know where your baseline is, for instance. And one of the things where we can really see this difference is in the Valley Medical Center, where our census, it's the number of people we have in a bed at any given time, has gone up over the last year, but we're able to get people into a hospital bed, say from the emergency room, or into the proper care setting at a faster and better rate, despite more people in the hospital, because of the continuous improvements we're making in, say, the emergency room. And we've got metrics like that. A service in the hospital, say, radiology, we've been able to get more patients processed through faster than we used to. Mammography, people used to have to wait longer than we would like them to get a mammogram and then have the results of that mammogram acted upon by the medical staff. We've got a much faster result process there than we did before we started this program. Those are some examples.
So how are these programs rolled out? You know, does someone say, I'd like to do this? Or, I mean, it's got to take some resources to put on this kind of training and effort.
Most of the resources are current resources, and this is actually the most difficult change in the mindset. We have Dr. Tabrizi. We have me. I'm not working in the budget office anymore. Now I'm essentially running a part of the administration called the Learning Organization.
Oh, okay.
Because we want people to feel as though the entire career should be continuous learning.
And you're a good example of that.
Thank you. I'd like to think so.
Oh, good.
We have teams of people, and getting them to realize that their job and the practices of continuous improvement are not mutually exclusive. That it's a little bit like writing with your non-dominant hand when you start working on the continuous improvement, because you're stopping what you're doing, you're noticing how it's being done, and you're thinking about how to do it better, and instead of just doing it. And that takes a little practice to say, oh, I have to slow down a little bit. But once people get practice, they realize it feels much more natural and that they can look at other processes. Turning around the operating room between surgeries, there's a team working on that, because if you have a delay there, then the surgery schedule starts to back up.
Oh, yeah.
And patients might be on a fasting situation, and we can't have them waiting and so forth and so on. So they worked on how to make sure they got the operating room turned around as fast as possible. And when they did that, the metric for surgery schedules didn't improve that much. And they realized that it was another side issue of getting the right people to the right operating room that needed to be turned over faster. And so now they're working on that. But if they hadn't done the first project, they wouldn't have realized that the second thing was actually a bigger problem. So that's part of the continuous thing. And then we also have a person named Ann Nicholson. And she came from the Kaiser Permanente organization. And they have something called Labor Management Partnership Work Groups. And we've adopted that model. And it's a continuous improvement model with metrics. And it's done in sort of a 90-day small acts of change.
Wow. This is really interesting. Unfortunately, our time is virtually gone. We have enough time for you to say, if somebody would like to contact me, they could email me, not to put words in your mouth.
Okay. They can email me.
Oh, okay, good.
And you can also call me. And the county website is sccgov.org. And we have a lot of information on our website for people too.
That sounds really exciting. Leslie, thank you very much for being on the show. I think we've all learned a lot.
Thank you, Steve.
Good. Thanks for watching Democratic Television. Give us a call at 408-445-9500 or visit our website, sccdp.org. Help make a difference, and we'll see you on the campaign trail.